we're here with the one and only Dr. Lester.
Hi.
Thank you for being here with us today. All right, so today we're going to talk about breasts, augmentation, reduction, and much more. But first, I want to ask you what you did for Christmas.
Well, we went to North Carolina, got a little cabin house, escaped the Miami heat, even though it was kind of cold here, but it was nice to be kind of secluded and in nature.
Nice.
Yeah.
What are your plans for New Year's?
I don't have any plans for New Year's.
Do you have resolutions for New Year's?
No. Just have fun.
Not even one?
You know, eat healthier. I eat a lot of junk food, so we'll try to cut that out.
I could agree. All right, so today we're going to talk about breast surgeries, augmentation, reduction, breast lift, implants, and all of that fun stuff. Ready?
I'm ready.
All right. So question number 1. Who is an ideal candidate for breast augmentation, breast lift, or breast reduction? And are there any specific factors that determine eligibility?
So when discussing a breast augmentation with a patient, we want to know whether or not they've had any kids, if they're breastfeeding or have breastfed in the past, and then we'll discuss sizing and different implant types. For breast lift or reduction, to know if you're a candidate for that, we always have to look at where your nipple is in relation to your inframammary fold, or the fold underneath your breast. That helps us determine if you need a lift and what kind of lift you'd be eligible for. So all of that would be done during your examination and pre-op.
Nice. Okay. For someone considering breast augmentation, breast lift, or breast reduction, can you walk us through the initial consultation process and what patients can discuss or ask during this meeting?
So during the consultation, we'll do a full exam, we'll take your measurements, and like I said previously, we'll determine whether or not you're a candidate for an augmentation or a lift. A lift and reduction are kind of synonymous terms. You have to remove some of the skin and tissue in order to raise or lift the breast. So it's just how much of that tissue we remove is kind of your new size. So we'll discuss your goals, the size you would like to be, and whether or not with your lift or reduction you'd need an implant with that. All this would be based off of, your measurements and your goals for the shape of your breast.
Okay. Could you provide a brief overview of what the breast lift procedure involves and the techniques you commonly use?
So a breast lift, like I said, is kind of synonymous with a reduction. It's just how much tissue is removed. And, sorry, I forget the questions. And how much tissue is removed. And then depending on the distance that the nipple has to move to its new position, we'll discuss different pedicles or safe ways to maintain the nerve and blood supply to your nipples. And then what type of lift you would need, because there's various types. We commonly use an anchor lift here where you get a scar around your areola, a vertical, and then underneath your fold. That's most common, but there's also lollipop lifts or crescent lifts that we can also use.
Does it leave a hard scarring in the nipple or not?
No, so your areola is downsized or sized, to match the new size and shape of your breast. But the scarring is not so bad.
Minimal?
You definitely see some of the scarring, but if you are not prone to keloids, you tend to heal pretty well.
Okay. Give us an overview of the different types of breast implants available here at Avana Plastic Surgery, and how do patients go about choosing the right option for them?
So ultimately, the choice is the patient's, but there's 2 types that we offer here, saline and silicone. So the shell that both implants are made of is the same. It's actually a silicone shell, but saline is filled with salt water and silicone is filled with a cohesive gel. So beyond that, there's the profile of the implant, which is how much it projects off of your chest, and then of course the size or the volume, which will help determine based off of your measurements and your goals for your shape. And all of this would be discussed during your pre-op. There's definitely pros and cons to both of them. In thinner patients, I tend to go for a silicone implant because you can feel the rippling of a saline implant. However, the pro of a saline implant is if you have any asymmetry in your breast, because there's a fill volume that we're able to use on the table that varies by a few cc's, where you can kind of even you out a bit more.
Does one rupture easier than the other?
They don't rupture easily. However, with a saline implant, you'll notice if it ruptured immediately because that implant would just deflate. Versus a silicone implant, if something traumatic were to happen and you were worried about a rupture, you wouldn't necessarily know if it was ruptured unless you got an MRI because it keeps it shaped really well.
Could that affect someone's health if it ruptures?
So normally, when you have an implant, your body creates a scar tissue capsule around it. You hope that it stays soft and mobile like tissue paper. And if that's the case, then if it were to rupture, the gel pretty much stays in the shell of the implant, and if it were to leak out, it's still kind of encapsulated in this scar tissue. So you'd have to go unnoticed with a rupture for a very long time for it to really seep out.
Jesus, let's avoid a rupture then. What are some common reasons why patients may consider exchanging their breast implants, and how do you guide them through this decision?
If a patient wants to change their breast implants, it's typically because they want to change their size. It's often also because, if they've had a rupture or they're concerned about a rupture, we can take out the implant. And if they've been in place for a very long time, the guidelines are roughly 10 years, but if the implant is healthy, your capsule is still soft, you don't have any pain or discomfort, and visually they're the same, they can definitely last longer.
Okay. In some cases, patients may consider a breast lift in conjunction with other procedures. How do you determine which additional procedures the patient could combine with breast surgeries?
So with a breast lift, it's a big cut, but we typically do these with tummy tucks, which are like a mommy makeover. So you can always combine those with any liposuction procedure. Like if you wanted lipo 360 with a breast lift, in the state of Florida, we're limited to how many cc's we can remove of fat. If you were to combine those two procedures, we're limited to 1 liter of fat, versus if you were to separate them, we could take 4. So depending on your size, your BMI, how much weight you have to liposuction, we can help determine that in pre-op.
That's a big difference between one surgery and two.
Yeah. So for the biggest bang for your buck, we would definitely want to discuss that prior.
That's good to know. All right, so in addition to aesthetic changes, are there potential health benefits associated with breast reduction that patients might experience?
So for breast reductions, breasts are very heavy, so that often cause neck and back pain, and in your pre-op we'll discuss, the size you want to be with the reduction, and it'll definitely improve a lot of your quality of life and your comfortability in clothing.
Okay. What is the typical recovery period for patients undergoing breast surgeries, and are there any specific post-op care instructions that they should follow?
For just an augmentation, usually patients feel pressure and tightness after surgery immediately, and within a week they're feeling much better. But the restrictions for both procedures, a lift and an augmentation, would be no heavy lifting or working out for about 4 weeks. For me, I put surgical tape on all of my incisions, so that stays for 7 days. After that, it comes off and you just apply Vaseline to the incisions. And you just have to wear the surgical bra that we give you for 4 weeks, and then you can change into whatever you want.
How quick can you shower after a breast augmentation?
For me, my patients have to wait 48 hours.
So 2 days.
2 days, that's right.
Oh. And in your experience, what can patients expect in terms of long-term results from breast surgeries, and are there factors that can influence the longevity of the results?
Yeah, so my biggest thing is patients typically don't wear great bras. Like anything with a spandex or a stretchy strap, you're gonna sag over time because implants are heavy, breasts are heavy, and if you're like running with like crappy sports bras or stuff that's not supportive, over time you're gonna sag and then require either another lift or a lift in general. So take good care of your implants and your boobs and wear good bras, something with a silk strap or like Velcro, something that doesn't stretch. They call them granny bras, but they're not the prettiest, but wear a good bra.
So you suggest like the push-up bra?
Well, push-up, it's less the cup and more the strap. You want support.
Okay.
You want them lifted.
So the strap is what's important.
Yeah.
Okay, got it. All right, so there you guys have it. I also want to remind you guys that Dr. Lester is having a special promotion in her BBL. Included in her BBL price, it's the free ab etching, so keep that in mind. All right, so thank you so much.
Thanks.
And
Happy New Year.
Happy New Year.